Hey, this is Stephen Opper, and today we're going to go over some self-abdominal massage. Um, it's an area that most people don't know how to address very well, especially on themselves. Um, so I'm going to show you a couple of tricks that work really well for me. Um, Disclaimer up front, I'm not giving medical advice, I'm not advising anybody to do anything. I'm just sharing my experience and what's worked well for me and for other people as well. So the video will be in two parts. First, just kind of briefly go over how to do it, and then the second part will go a little more in depth into the anatomy and contraindications and that sort of thing. Um, so basically all we're going to do is we're going to go around the clock. We're going to have a ball, and we're going to slowly go around the clock on your belly. Now that clock is defined by the borders of, down at the bottom is your pubic bone, just above your genitals. We don't want to put direct pressure on that. And then going up in a V is the inguinal ligaments, or the ligament on each side. We don't want to put direct pressure on that, but we can put pressure above it. And that comes up to the ASIS, these little bony prominences here. Then we've got a bunch of soft tissue. Start getting into the floating ribs here. We want to be careful not to put too much pressure on those. And then the border under the ribs and the costal cartilage. We're not going to so much put pressure on the ribs themselves, but you're underneath it and right up to it. Center line is the xiphoid process, fragile bone that we don't want to put direct pressure on. Trust me, it'll get painful before any harm comes to it, but you don't want to put a lot of pressure on it. The midline is the linea alba. There are techniques and traditions that people work directly on that. However, I would caution against it. There's these side connections that aren't terribly strong, and putting a lot of direct pressure on it can weaken those connections, which can allow for a bulge. So you don't want to do that too much. Just to the left of midline is the linea alba running vertically, except on rare people where their organs are flipped and it's on the right side. Most of us, it's on the left side. It can take a little bit of pressure, but you don't want to totally occlude it. You don't want to cut it off. If you start feeling pulsing, you'll know you're getting close to it. If it's still pulsing, it means you haven't totally cut it off. But if that pulsing gets stronger, it means you're putting pressure on it, and that's when you need to be cautious. I'm not trying to scare you. I do want you to know that there's things to be aware of in there. So basically, the reason there's 3 different body positions that we can use, which is why we have a couple different balls that work better in different positions. And there's 3 layers. There's the superficial abdominal muscles, which can benefit from this. Deep to that is the organs, which can receive great benefit from it, but you also want to be cautious and gentle with them. If it can heal, it can harm. So first, do no harm, especially to yourself. We want to avoid pain, especially sharp pain. This should not be painful. Sharp pain doesn't mean freak out. It does mean lessen the pressure until it's no longer painful. One of the most painful things in there is actually just gas bubbles, which are not an indication of doing harm, but they are surprisingly painful, and often they'll move out of the way. If you lessen the pressure, it can actually greatly benefit the digestive organs, but you don't want to be causing yourself a lot of pain. Then deep to that are the deep abdominal muscles, some of which attach to the front of the spine, the psoas and iliacus, etc. So those can really benefit from this type of work. The nice thing about using balls is that it's not pokey. It diffuses the pressure, and so you're getting pressure without, it lessens the risk of doing any harm or bruising things in there. There's always some risk, but this is way more comfortable than somebody putting their finger in there, unless they really know what they're doing. So having said that, the 2 balls I've got are, this is a medicine ball. It's a sand-filled ball with a little cushion of air, which is nice, helps diffuse the pressure. This is 8 pounds. That works well for me. Some people need more, some people need less. But basically, you want it to be something that can fit in between the spaces of your bones. So this is a little bit on the small side because I like the way it fits. Most of them are a little bigger than this. Then here we've got just a inexpensive, hard plastic ball. I find these work best if they're slightly deflated. Fully inflated works fine. If they're deflated, they'll mold to the shape of your body better, and it'll be less painful, and you'll actually get better results with it. And if you want to spring the extra $2, you can get a Spider-Man on yours too. So the first position is laying on your back, and that is the reason for the medicine ball, because the added weight really helps. So all we're going to do is bend the knees and put the feet flat on the ground. That just takes pressure off the back and puts some slack in these muscles. And we start out gently placing it somewhere, get to know the pressure. I strongly suggest the first several times that you do this sort of thing, you do it more as an exploration and get to know the sensations in there. As you get more and more familiar with the sensations inside your abdomen, then you can start applying a little more pressure and being a little bit more specific. But really get to know it first. It's a lot of strange sensations that most people aren't familiar with. So then very slowly, we'll just kind of work around that clock. And when you find an area that needs a little extra attention, if the ball's not enough, you can rest your hands on it, or you can apply a little extra pressure with your hands till you get to that nice feeling as if you were getting a deep tissue release in any other muscle in your body. Should be basically the same sensation, not pain, but just enough to know that you're on to something good. And when you find a good spot, hang out a little while before moving on. And so, like I said, just slowly, much slower than this, you just go around the clock. If you get to the point where that's not quite enough pressure for you, then we can go sideline or kind of at a 45-degree angle. And now you can still use this medicine ball, or you can use this rubber ball for this. This is a little more intense because your body weight is on it. One of the tricks with any type of massage or self-massage is whatever muscles you're working on, you want to be not having to work. You want them to be released and relaxed. What that means is my whole body weight should be supported by my arm and by my hip. And then really focus your attention in there, trying to relax things as much as possible until you sink into the depth you want. But control of your body weight is important to be able to do this safely and effectively. Now in this side or diagonal position, we can only get so much at one time, and then we just have to switch sides and do the same thing on the other side. If that's not enough for you, then you can, and these work well for the sideline or for belly down. And you start laying belly down if you need a little bit more pressure. And be cautious, be slow, be methodical, and just pay close attention to what you're doing. Should not be painful. You want to feel it, but there should be no pain, especially no sharp pain. And then little by little, you kind of work your way around the clock until you find a spot that needs attention. And then you just hang out there. All right. So let's take a closer look at the anatomy now. This is the first layer under your skin. This is the external obliques showing. Notice the linea alba in the front as well. This is the next layer deep to that, showing the rectus abdominis and the internal obliques. And here I've highlighted the fascial line where the rectus abdominis meets the internal obliques. This is corresponds to the spleen-pancreas meridian in Chinese medicine, but it is an excellent reference point for being able to access some of the deeper layers. By applying pressure along these lines, it seems to be a bit easier to access some of the more internal structures. And then deep to all that is the transverse abdominal muscles, and issues with any of these layers of muscles will negatively affect the entire skeletal structure. So it's a great method for addressing all these superficial abdominal muscles. Then we have the viscera. There's a whole lot going on in here. We're not going to get into all of it, but the first thing to notice is that most of the abdominal cavity is taken up by the small and large intestine. And as I mentioned, they can be quite tender if there's any issues going on with them. Be slow, gentle, and respectful, and they will thank you for it. That's actually all covered by an organ not pictured here called the greater omentum, which they found not only has a tremendous influence on digestion, but on emotional health, particularly in relieving depression. So there's a lot of great reasons to be working with the viscera. You just need to be respectful with it. Also of note is in the upper right corner under the ribs there is the liver. In this picture, most of it is underneath the ribs, although people have anatomical variations, and if there's any inflammation or issues, sometimes that'll hang below the ribs and you'll actually access some of it. Same rules apply. Be respectful. You don't want to bruise it, but you do want to address it if it's there and there's any issues going on. And behind all that are the deep abdominal muscles and the kidneys. Here I have highlighted in green the psoas major, and you can see where it attaches to the front lateral side of the lumbar spine. This is one of the keys to relieving low back pain. However, don't be in a rush to get there. This is the direction you'll be heading towards, and you may never get there. It may take 10 sessions. Don't worry about it. Also, just be aware of that the kidneys sit on top of the very top attachments of there. So pressure may reach them as you get in deep. Just be aware of where they are and be cautious around them. And here I've highlighted some of the areas to be cautious with. We've got the linea alba down the middle. We've got the floating ribs up top in blue. And then we've got the inguinal ligaments there in blue. We want to avoid putting pressure on any of those. And here's how all that looks from the side. And then right up against the front of the spine is the aorta. It's buried, it's designed to be well protected, but it's important to know what's in there. And there it is from a side view, so you can see how it is right up against the front of the spine there. Well, you should be well equipped to go on an adventure in your own abdomen. So happy trails. And there it is from a side view, so you can see how it is right up against the front of the spine there. well, you should be well equipped to go on an adventure in your own abdomen. So happy trails.